Hello everybody. I'm going to use this specimen to show you anatomy of the heart. Okay, this is anterior side and this is the posterior side of the heart. So this groove over here is anterior interventricular sulcus. So this is the left part, left ventricle, right ventricle. This structure over here, this is left auricle that sits on the top of the left atrium, and a right auricle sits on the top of the right atrium. Blood vessels. So this first blood vessel over here, this is pulmonary trunk. This blood vessel, this is aorta and brachiocephalic artery. Now on the posterior side, this is this groove over here, posterior interventricular sulcus, and okay, so over here you would have superior vena cava and inferior vena cava. So that's what you need. Actually, those are the structures that you need to know for your exam. Again, you need to know that this is anterior side, anterior interventricular sulcus, posterior side, posterior interventricular sulcus. You need to know this part that is the right ventricle, left ventricle, right auricle, left auricle, the pulmonary trunk, aorta, brachiocephalic artery. And we cannot really see this superior and inferior vena cava very well, and we cannot see any pulmonary vessels. Now, if you look at the coronary section, so the couple structures that you need to identify. So you need to know that this is myocardium, so that's a muscle bulk of the heart. You need to know that where we have this thick muscle, this is the left ventricle, so this is the right ventricle. If this is my left ventricle, then this is my bicuspid valve, and this is my right ventricle, so here I have my tricuspid valve. This structure over here are called chordae tendonae, and those are papillary muscles. So they anchor AV valves to the walls of the ventricle, prevent them from prolapsing back inside the atria when ventricle actually contract. And here, this is our aorta. You can even see this is aortic semilunar valve. Okay, so here's another half, right? So again, where we see big muscle, so left ventricle, right ventricle, left ventricle, that bicuspid valve over here, chordae tendonae, papillary muscles, and this is the septum, interventricular septum. Okay, thank you for watching.